Let's talk about how we can engage our core with movement during pregnancy. I'm Dr. Nichelle Gurley and I'm specialized in prenatal and postnatal movement. I like to use the model of EEE, exhale, engage on exertion, which this follows the thought process with the piston breath, which is going to be when the rib cage is stacked nicely over the pelvis, which is not always the case with our pregnant belly, but we're still going to utilize the concept. And this is something you can roll over into those early postpartum months with movement. So let's talk about the piston breath for a moment. As we inhale, our lungs fill and our diaphragm lowers. Our pelvic floor also lowers slightly. As we exhale, the air exits, the diaphragm comes up, and our pelvic floor recoils. So with each breath, we have this interaction of the core together, that diaphragm interacting with that pelvic floor. It'll shift a little bit based off of if you're postpartum and you have a curvature or you're tucking, and it'll absolutely shift a little bit during pregnancy, again, because our rib cage isn't quite as stacked nicely over our pelvis. We can do our best, but there's just a lot in that middle that'll change this up. So on the exhale, you notice that the pelvic floor recoiled. So we're using that exhale with our engagement. So I have another video that talks about deep core engagement that you can watch to get a greater idea. But what I want you to think about with engagement is an intentional lift of your pelvic floor and an activation of your abdominal wall. So during pregnancy, you can use whatever cue works well for you with the pelvic floor. I like to think about my pelvic floor coming up and in as if it's drinking a milkshake through a straw up through the vagina. Weird cue, but it works really well for me mentally and a lot of other people. I also like to think of the 4 points of my sits bones, my pubic bone, and my tailbone all coming together to a center point and coming up. For my abdominal wall during pregnancy, I really like to think about my pubic bone trying to meet up with my belly button. So it's not a pulling in of my belly button and a gripping, it's a lower belly lift. So all of this with the engagement is going to be a lift, not a grip. This should always meet your load. So if you're lifting a really heavy box for whatever reason, you will engage a bit more than if you are just doing the movement as body weight. So let's talk about that again. So it's going to be exhale, engagement. So we talked about the exhale and the engagement on the exertion. So if I'm coming down to the ground with a squat, we'll say I'm actually lifting up a box, and so we'd like to do it in a good way with a squat. I would come down to lift up that box, and it's the hard part is coming up. The exertion is coming up. So it would be inhale down, lift pelvic floor, engage lower belly on that exhale. So that exertion part is when you're going to do the engagement paired with your exhale. So if I were to do a deadlift, it would be inhale down, engage on that exhale and that rise. Because the hard part of the deadlift, the exertion, is coming up. So you have to play around with each movement and decide what part of the movement is the hard part. That is when I will use my exhale to engage with my core. And again, the engagement is more of a lift. It's not a gripping. So that is the how to lift and do movement during pregnancy while utilizing your core to help stabilize all different areas of your body to hopefully do these movements in correct ways. You will do this with the exhale, engage on exertion mindset. And you can practice this with body weight. So before you go and lift something heavier, you understand how to do this movement with your breath.